Trump admin's cane sugar Coke move, MAHA win or political theater. In a surprising twist, Coca-Cola has announced that it will soon offer a version of its iconic soda sweetened with cane sugar in the United States. This decision, which has sparked both praise and debate, is being celebrated by the Trump administration as a victory for their Make America Healthy Again, MAHA, initiative. But here's where it gets controversial. While some see this as a step toward healthier choices, others argue it's merely a superficial move meant to distract from deeper public health challenges. Let's dive into what this really means, and why it matters. Coca-Cola's announcement centers around offering a cane sugar, sweetened option alongside its traditional formula, which uses high-fructose corn syrup, HFCS. According to President Donald Trump and Health and Human Services Secretary Robert F. Kennedy Jr., this shift aligns perfectly with MAHA's goals of improving American health. However, nutrition experts caution against viewing this change as a significant health improvement. Both cane sugar and HFCS have nearly identical metabolic effects, meaning swapping one for the other won't drastically alter the nutritional profile of the beverage. Critics suggest that the move might be more about optics than actual progress, especially given recent rollbacks in areas like food safety regulations and pollution controls. This development raises an important question: is Mexican Coke, already sweetened with cane sugar, truly healthier than its U.S. counterpart? Dr. Robert Lustig, a leading expert on childhood obesity, says no. He explains that there's absolutely no difference between sucrose, cane sugar, and HFCS when it comes to their impact on your body. Both contribute to mitochondrial dysfunction and chronic diseases like diabetes and heart disease. The main distinction lies in cost. HFCS is cheaper, allowing manufacturers to use more of it without breaking the bank. So, if you were hoping this switch would make Coke a guilt-free indulgence, think again. But wait, there's more nuance to unpack. While Coca-Cola insists that HFCS is safe and metabolized similarly to table sugar, emerging research hints at potential differences worth exploring. For instance, HFCS contains higher levels of free fructose compared to cane sugar, which could lead to greater inflammation and fat accumulation in the liver. Unlike glucose, which fuels cells throughout the body, fructose is primarily processed in the liver. Overconsumption can result in elevated triglycerides, insulin resistance, and even non-alcoholic fatty liver disease. Does this mean HFCS is worse? Not necessarily, but it does add complexity to the debate. Meanwhile, the logistics of Coca-Cola's pivot to cane sugar present another challenge. Currently, the U.S. produces far less cane sugar than it consumes, so companies may need to import supplies from countries like Brazil, where steep tariffs exist. This could drive up costs significantly, potentially exceeding $1 billion across the beverage industry. Corn growers who rely on HFCS production for income also stand to lose out, creating economic ripple effects. PepsiCo has expressed openness to adopting cane sugar if consumer demand shifts, but experts warn that any perceived health benefits are likely minimal. At the end of the day, this could be more about marketing savvy than meaningful dietary change. Amid these discussions, Senator Roger Marshall, Republican Kansas, is taking a different approach to promoting health through his support of the MAHA movement. As a proponent of agricultural reform, Marshall emphasizes the importance of soil health in producing nutrient-dense foods. His legislative package includes nearly 30 bipartisan bills aimed at fostering sustainable farming practices, expanding access to primary care, and addressing youth mental health. By focusing on collaboration rather than mandates, he hopes to tackle rising rates of chronic illnesses linked to poor diets and environmental factors. Could this holistic strategy hold the key to lasting change? It's a compelling idea worth considering. Elsewhere, Texas Attorney General Ken Paxton is making headlines with his investigation into Mars Incorporated, the maker of M&Ms and Skittles. Paxton alleges that the company violated consumer protection laws by failing to remove artificial dyes from its U.S. products despite pledging to do so in 2016. While Mars phased out synthetic colors in Europe due to stricter regulations, it continues to use them domestically. Critics argue that these dyes pose health risks and mislead consumers, prompting calls for greater transparency in food labeling. Is this crackdown justified, or is it an overreach? Share your thoughts in the comments below. As we reflect on these developments, one thing is clear: the conversation around food, health, and policy is far from black and white. Whether it's Coca-Cola's cane sugar experiment, Mars artificial dyes controversy, or broader efforts to overhaul organ transplant systems, each issue invites us to weigh competing priorities and values. What role should government play in shaping our diets and lifestyles? And how do we balance innovation with accountability? These are questions worth debating, and they highlight just how complex the path to better health truly is.